So for this video, I'm going to go through some COVID-19 stats in the US and talk a little bit about what they mean. We officially hit 3 million cases and 130,000 deaths. I know this site isn't completely updated yet. They usually do it around 7 or 8 o'clock in the morning, but this site gives a good visual representation of what's going on, so I'm using it for this video. We also hit 130,000 deaths, a very grim number, especially considering the mass lack of grieving that we're seeing. I mean, I've seen more posts about remembering 9/11 victims than I saw about this COVID, which killed many, many, many more people. At one point, we were basically having a 9/11 per day when it comes to death toll, and these deaths are in very dark ways. People die by themselves. Their family members are not allowed to be in the hospital room with them as they die. It'll be on FaceTime. The families can't hold a proper funeral after someone passes. So it's really, really scary to see our society be really sociopathic in tendency and worry more about going to the store and to the bar and to restaurants than they do about the lives that are being lost. There's really a lot of conspiracies being made up that these deaths are a result of people dying in like car crashes and they happen to have COVID, so they put that into the database. When in reality, it's more likely that these deaths are undercounting how many people actually die from COVID because the highest death rates are in places that are underserved communities, and these poor communities got the good testing last. So pretty much every actual study that isn't a conspiracy theory says the death number is higher than it says here. It's probably around 135 to 140,000 people dead already, although you're going to hear conspiracy theories that they're counting people for COVID deaths when they didn't die of COVID. Those stories are completely false and not backed up by any data. Right now, we're saying basically as a country that we're doing so much testing, and that's why we're getting so many new cases when in reality, I'm going to go down to testing really quick. Even at this testing number, we are still ranked per capita 25th in the globe when it comes to countries in testing per day. The United States is not testing at a good enough rate to justify how many infections are happening per day, and it's a lot of them. And if you keep on going down, you can see that yesterday, which is July 7th right now, there were around 48,000 new confirmed cases, 17,000 recoveries, 330 deaths. And it shows the 7-day rolling average and how much things are predicted to grow in 7 days, 14 days, and 30 days. This is the current U.S. mortality rate, which has been going down as more tests have been coming in, although not enough. And here is what the global rate was set at by the World Health Organization. And people are asking me a lot of questions lately about deaths and why we're getting 50,000 new confirmed cases and a low amount of deaths. And part of that is that we're testing more healthy people. That does go into it. But another thing that happens with this particular virus is it doesn't kill people right away. I mean, typically when you get tested for it and you get put into that database, it takes a couple weeks to a month to actually kill you. So deaths are going to lag. They're already catching up due to spikes in cases, and we're at 330 today. We were at like 200 in our nation yesterday, and I'm really interested to see what the numbers are going to be for July 8th, which is going to be when this video is actually out. You can see predicted deaths based on our current rate of growth, and this is a slow rate of growth. So we're predicted in 7 days to have 147,000 people dead as a result of COVID, and in a month we're predicted to have 240,000 dead as a result of COVID, 108,000 new deaths in 30 days with the new heightened spread of the virus because local governments have let things go. They loosened restrictions. I'm in Pennsylvania where the governor did an amazing job preventing the spread of corona, but it's still picking back up because people aren't wearing masks. People aren't taking it seriously. And this is a chain reaction type of thing where people are kind of using the anti-vaccine argument of I haven't seen smallpox in forever, or I haven't seen the bubonic plague in forever. Why are we getting vaccines? And the reason we're not seeing these diseases pop up again, whatever the actual correct ones are, is because we're doing these vaccines, we're getting vaccinated, and we have this herd immunity formed. That's why we're not seeing these vaccines, and that's what gives these anti-vaxxers ammunition to try and discredit the science, The same thing is happening right now with COVID-19. People are saying, I don't see COVID-19 in my area. Like, for instance, my hometown has really low population density. There's no tourist attractions around us except an amusement park about a half hour away. And there's not many cases here. And people are using that as a reason to think, wow, it's not a real thing, versus thinking, wow, the governor's orders to shut down the state really worked, and masks are working, and social distancing is working. Instead of doing that, they're saying, well, the virus isn't real because I can't see it, although there are so many people dying every single day in extremely painful fashions. So moving on to cases and deaths, you can see here that the largest spike in deaths came around mid-April, which is when ICU beds in New York got overloaded. Most of that toll was actually from cities like New York, really impoverished communities where they didn't have access to proper healthcare. And you can see here that lag I was talking about. The highest average cases actually preceded the highest death rate and the death toll, because the cases take a long time to develop and actually move forward and ultimately reach the worst final destination. You can see here there is a huge uptick in cases. I don't expect deaths to spike this greatly, that quickly, because there are more healthy people being tested and getting it, and more solutions are being administered from doctors. More drugs are being tested out, and better, remedies are being found as science keeps on working on this issue. I don't think deaths will spike up this much, but I do think they will spike up again, and we're going to be at 50,000 cases on average a day, probably today, July 8th. Moving down to mortality rate, you can see it fluctuate. I don't really take much into this. I look at different age groups. You can see that if you're above the age of 70, the mortality rate's like 15% across the country. If you're under the age of 50 or 45 or something, the mortality rate is like 1 to 2%, which is still very, very, very high. If you're in a room with 100 people and 2 drop dead, I mean, that's not a good chance to take. It's not good at all. And that death rate ticks up, up, and up when ICU beds get filled up. And that's what we're seeing right now in certain areas around the country that are being overloaded. You look at testing, of course, Trump likes to tout this, but like I said, we are ranked like 25th in the entire world. All right, so this is a fun one. Flu comparison. People loved to tell me that COVID-19 was simply the flu, the sniffles, get my 4-ply tissue and, your lotion soft tissue and wipe off the sniffles and you'll be fine once you get COVID. When in reality, COVID is much more deadly than the flu, and it spreads much faster than the flu. Last year, the flu killed 30,000 to 60,000 people. And the first week of COVID, people would say that to me like, oh, COVID only killed 1K. And I'd be like, dude, we're in a developing pandemic. A developing pandemic in which all the people who know what they're talking about are telling us this is more dangerous than the flu. The death rate in other countries was 20 times higher, 30 times higher than the flu. And lo and behold, after 2 months of COVID, we reached the year toll for estimated deaths caused by the flu. If you want to go at the low end, it took 1 month to reach that number with COVID of people dying. The death rate has been huge. And when you talk about all the precautions put in place for COVID and that many people still died, it gets even more insane. And it's a really contagious. It's really, really infectious. It spreads to a lot of people. I think the number on average is if you have it, you usually infect 2.3 people without precautions. The flu, you usually infect 0.7 people if you have the virus. So on average, every person who has the flu infects 0.7 people. And that makes COVID so dangerous if it could spread fast from people who are asymptomatic, which is one of the key traits of why this got so bad. You talk about a virus like Ebola, which has a mortality rate of, 80% of the people die if you get it. That's going to kill a couple people because, one, society's going to take it seriously and freak out, and two, the virus will die with the hosts. With COVID, it'll keep living forever. So quantity is better than quality when it comes to how viruses kill you. And COVID could spread around like, I can't believe it's not butter, like like on toast or something. And it's really, really disgusting that we would even make this comparison. Trump said it's just the flu. Trump said COVID's going to disappear, but we know this is far from the truth. And when you look at state level stats, you can kind of look through that, see where the high death rates are. Total mortality rate, total recovered, total deaths. Like I said before, New York City accounted for most of those early ones. The mortality rate in New York City is 8.1%, a huge number. California, 2.4%. Florida is around 2%. Texas is around 1%. New Jersey is around 9. I can't really trust Florida or Texas because they both made efforts to suppress the actual numbers of how many people died from it, like they criticized China for doing, by the way. Illinois, 5%, Massachusetts, 7%. You could read down the list. My state of Pennsylvania has been a 7% mortality rate, and I'm not sure why different states are higher or lower. It might be because of environmental factors. It might be because of healthcare factors or whatever, how much care people could actually get. But you could see through this list and look at it for yourself then. I'm not sure what this site's even called. Apparently, COVIDusa.net. Like, when this entire thing started, Donald Trump was taking it seriously. He called it the invisible enemy. He had a war mentality to it that we would have to come together as Americans to fight it. And then his daddies in the stock market came and his corporate overlords came and said, "Hey, Trump, we can't close things down. We can't protect people because that'll be bad for the market. That'll be bad for us. We won't help you get reelected or whatever," because he's a really soft human being. And he listened to them and he completely overturned everything. His approval rating was going up because he was sort of proving to people he could take things seriously and he could do a decent job. But, his approval rating spiraled once he took the herd immunity, free market, kill your grandma for the economy route. And now people are becoming desensitized to it. And that's the new Trump campaign strategy. His advisors have come out to pretty much say this. It's been spread in campaign emails. They're trying to hope people just don't care about COVID-19. The strategy is to hope COVID-19 doesn't affect enough people to affect Trump's reelection, essentially, because it's all about politics of perception. If people aren't directly affected by something, they usually don't give a shit about it. And, that's what he's banking on for this election. And people on the ground aren't wearing masks. My whole PA state legislature won't wear their masks. They're denialist. They're calling our governor a tyrant for instituting the policies he has in place right now. And it's an entire, shitstorm. There's fake articles being shared around. Everyone's telling me COVID-19 has a 99.7% survival rate, which is absolutely false. Schools are trying to open back up. I'll be doing a video on that on Sunday. I'll be going live with a couple friends from school to discuss how colleges can actually reopen with COVID-19. Harvard's going full online. And, there's chain reactions to this stuff. I don't think people understand how serious this actually is if they didn't completely face it themselves. And it's really sad that there's going to be, at the end of this year, around 300 to 400,000 people dead and nobody to really care or grieve about it. And hopefully I could be proven wrong about that as our society progresses and moves on with this crisis. Are we going to pull together with our common humanity, or or is 2020 going to keep on going downhill?
We're all learning. Everybody's learning. Yeah, we're all learning 'cause life is hard. Yeah.